Thank you again for joining our HIPAA 101, 5 Tips to Compliance. Wanted to start the discussion today with a quick introduction to HIPAA. What is HIPAA? What is it all about? What are the core objectives of HIPAA? Let's take a quick deep dive into specifically the security rule. We will look at what are the costs of noncompliance, and then finally wrap up with the bulk of our majority here around those 5 tips towards achieving compliance and if nothing else, taking steps in the right direction. So quickly, what is HIPAA and what is it all about? HIPAA is the American Health Insurance Portability and Accountability Act of 1996. Signed by President Clinton, it was really created to provide a set of rules to be followed by doctors, hospitals, and other healthcare providers. The ultimate goal is to ensure that all medical records, the billing process, patient accounts, that they meet consistent standards with regards to the documentation, the forms used, how that information is handled throughout the transactions, as well as the security and privacy of that data. When you look at HIPAA, it's often broken up into 3 main components: the privacy rule, the security rule, and breach notification rule. There are a number of subcomponents and things like the enforcement rule, and most recently the HIPAA omnibus rule, but those really are your 3 main components and what we'll be focusing on here today. So what does HIPAA cover? It covers transactions, right? We are trying to standardize the process of dealing with healthcare information, whether that is diagnostic and treatment codes or the forms and tools that are utilized therein. It also looks to standardize the identifiers. You may have heard of the ICD-9 or ICD-10 code sets and how those are used throughout the transactions. The privacy rule focuses on who can access PHI, and that's PHI in all forms, whether that's oral, written, or electronic, how those records may be shared or not shared, and how the information needs to be safeguarded. Security, in a similar vein, but now focused only on electronic PHI, is really around how that information is protected, both in storage and in transmission, throughout the life cycle of data in the healthcare process. One of the questions that we get quite often is who needs to comply to HIPAA, who needs to be in alignment with the framework. There's 2 main types of organizations as defined by HIPAA, and that is covered entities and business associates. Covered entities you can think of as kind of your core healthcare players. Those are the providers, the health plans, the healthcare clearinghouses. For the most part, you know who you are. You are clearly dealing in the healthcare space day in and day out. Your primary means of making a living is dealing with patient care or on the payer side with the adjudication of claims and in the clearinghouse space. This other area called business associates is one that can often be a little confusing. You are basically an organization that supports the healthcare industry in some way, shape, or form, whether that's through claims processing, even consulting services or data analysis, legal services. You are an organization that comes into contact with healthcare-related data and deals in a business and organizational sense with healthcare covered entities. It's also important to understand that you can be both a covered entity and a business associate. As you think about some of the services that, for those of you on the phone who you may offer, you may absolutely be classified as a covered entity, but part of your service offerings, part of your package, is to provide ancillary services to other covered entities, and so in that sense, you are one of their business associates. It's an important designation because as you think about some of the privacy and security requirements, having things like business associate agreements and contracts in place, again, you can be both a covered entity and business associate. Another question we get a lot, and it's good to kind of level set, what is PII versus PHI? Personally identifiable information versus protected health information. As HIPAA defines it, there are 18 core elements of PHI, and those are the elements that are highlighted as we go around the ring. Some easy ones that you can see: contact information, personal characteristics like date of birth and biometric data, obviously your social security number and all of your medical records. One thing to point out is in the very top right, that one additional item. That is really HIPAA's catch-all that says any other unique identifying number, characteristic, or code as it relates to your health data. Those are things now, today, like the serial numbers and unique identifiers of your wireless pacemaker or of the wireless CAT scan machine. It was actually very forward-thinking of HIPAA as they were writing the regulation to allow themselves that latitude to say any other unique identifying number or characteristic and include it as part of the PHI subset. So we've talked a little bit about what is HIPAA. Now I think the natural step is to start to say, well, what are the objectives? Again, there are three main components: privacy, breach, and security. I want to quickly touch on privacy and breach and then really focus our conversation on the security rule. Privacy, you can think about it as laying the groundwork and the foundation for all of the other rules. So privacy covers who is covered, what information is protected, the permitted and authorized uses and disclosures, establishing something called minimum necessary. An easy way to think about that is you think about sharing data from organization to organization. What's the minimum amount of data that needs to be shared in order to accomplish that mission? We don't need to be sharing our entire data set or even collecting unnecessary information from our customers. Notice and individual rights, and then finally establishing those penalties for noncompliance. On the breach side, really three main aspects of the breach rule: when to notify, who to notify, and then the timeliness of those notifications. You know, knock on wood, hopefully everyone here on the phone never has to learn or deal with a breach rule, but in the event of a breach, again, it kind of lays out that foundation of the who and the when on how to provide those notifications. Okay, so the security rule. The security rule is really focused on implementing what you may have heard as the CIA triangle. That is the confidentiality, integrity, and availability of PHI. The security rule breaks up into three safeguards and then a fourth component called the organizational requirements. This is when you hear people talk about HIPAA or doing a HIPAA assessment, HIPAA risk assessment, this is often what they mean. They are looking at the administrative, physical, and technical safeguards in place to protect the creation, storage, transmission, and use of PHI within that organization. We'll walk through each of these different safeguards in a little bit more detail. One point I wanted to make here: the implementation specifications around required versus addressable. There's often a point of confusion there that addressable means optional, and that is a big myth within HIPAA. I wanted to spell that for you. Both required versus addressable are needed to be in place. Required needs to be implemented as is, as stated within the framework. However, on addressable, you do get a little bit of latitude in how you implement that control. You can implement it as stated, or if you have a mitigating control that you can put in place, you can meet the control's intent and requirement through that mitigating control. All of that is documented as part of your risk assessment, which falls under the administrative safeguards component. So let's take a look at administrative safeguards and what are some of the components. First and foremost, what we're looking at here is the control standard, and then some of the high-level topics that fall into that. This is by no means all of the administrative safeguard and for the next safeguards coming up, but really just the high points. From a security personnel standpoint, designating an official security officer who is formally responsible for maintaining those policies and procedures and overall operations within the environment. In information access and management, we're looking at actually governing the access to PHI, and as we get to the technical safeguards, we'll look at how we technically control access to PHI. The workforce training and management can't be overstated enough in today's threat landscape. Super important. It is providing security training to your end users, both on HIPAA compliance, on compliance with your own policies and procedures, as well as what I would add is just a general best practice, overall security awareness. Also within this control standard is the ability and capability, I should say, to apply sanctions when a violation of policy occurs. Evaluation is the periodic assessment of your own organization's policies and procedures against the requirements of the administrative safeguards. So a little different than what the evaluation we're about to talk about here in our final area, security management process. This is probably our number one question that we get. How do I conduct a HIPAA security risk assessment? Just like in a number of other areas, HIPAA was very intentionally vague, and that's because there's no one way to conduct that risk analysis. However, they do give you kind of four high-level points that they want to make sure you're hitting. From an evaluation standpoint, first and foremost, evaluating the likelihood and the impact of potential risks to that electronic PHI. Once you've evaluated those risks, implementing appropriate security measures to address those risks in that risk analysis. Documenting the chosen security measures and, where required, the rationale for adopting those measures. And then finally, in the maintenance portion, maintaining continuous, reasonable, and appropriate security protections. Again, HIPAA does not give specific guidance on exactly what to do. Oftentimes that's a complaint. I would actually give them credit to say that they were forward-thinking and understanding that technology is going to change, security is going to change, and so we need to give you the framework, teach you how to think about this, but not exactly what to do. And so in that maintenance piece, really around the continuous learning process and going back through to make sure your risk analysis, risk assessment is continuing to be valid. As we look at physical safeguards, two main components here. One is the facility access control, and that's pretty straightforward. It is limiting physical access to facilities to only those authorized individuals and approved or supervised visitors. The workstation and device security is all about defining that proper use of and access to workstations and electronic media. Controlling electronic media is really the crux of this control standard, whether it's the transfer, the removal, disposal, or reuse of any of that electronic media. That can be your laptop, it could be your desktop, it could be a CD, a USB drive. These are all different samples of electronic media. Technical safeguards is a big one, and this is often where the rubber meets the road, if you will. So in access control, on the administrative side, we had talked about that's the governance for access control. Now in technical safeguards, we're actually looking at how we technically control access to ePHI and limit it to only those authorized persons. Encryption and decryption mechanisms are also part of this control standard. Audit controls is another big one where we look at recording and examining access and other activity and information systems for those pieces of infrastructure and hardware that contain ePHI. Oftentimes the confusion here is around, I have a ton of logs in my environment and you end up kind of drowning in the sea of logged information, but what do I do with it? And so there are components here around not just recording the activity, but examining it and including a process to regularly monitor those logs, looking for anomalies, and then taking action and follow-up when you find something. Integrity controls are really looking to make sure that PHI is not improperly altered or destroyed, whether in storage or in transit. And then finally, transmission security. Again, these are the technical security measures, and there can be many that are put in place to protect ePHI as it's being transmitted over an electronic network. Oftentimes, encryption is another main technique that is employed here. And as you can see on the right, I wanted to spend just a minute on encryption. Technically, it is not required as part of HIPAA, but as it states, encryption should be implemented if an entity finds it would safeguard ePHI. And if not, you can implement an alternative, but you need to document the case for doing so. Again, they give you that framework of how to think about the risk, first identifying the risk, and then putting together a plan to mitigate it. Encryption is by far the de facto standard to mitigate that risk, but you can tackle it a number of different ways, and again, not technically required by HIPAA. For those of you who may not be aware, encryption is really just the process of encoding, and so you can see we have an example here where we would take the word HIPAA and encode it to be a mix of characters. There's a number of different types and techniques of encryption and different strengths, but again, HIPAA is intentionally vague to allow for that technology and that security practitioner mindset to advance. There are two main publications from NIST which relate to encryption and are often referenced as part of a security risk assessment and specifically a HIPAA risk assessment. NIST FIPS 197 and FIPS 142. 197 is specific to a type of encryption called AES, and then the FIPS 142 publication really looks to first risk rank what it is that we're trying to encrypt and then defining the best solution to go forward. Both of these are acceptable frameworks and publications to reference in terms of implementing encryption with your own environment, and again, I would say 90 to 95% of our clients fall back on one of those two publications when it comes time to encrypt their information, how to go about doing that. Organizational safeguards. There's really three main components here. First is around the covered entity responsibilities. It is the covered entity's responsibility to ensure that the business associate safeguards ePHI. And again, I want to stress that. Oftentimes you fall back on your contracts to say that, well, because this vendor is going to be doing our data analysis or our data hosting or some level of services for us, they take on the risk of safeguarding my information. They are absolutely on the hook, but you ultimately own the responsibility to ensure that that business associate is safeguarding your PHI and is meeting the contractual requirements of the business associate contract or agreement. You'll often hear it as a BAC or a BAA. Also in this control standard is the consistent use of those agreements and that they contain the appropriate security language. Policies, procedures, and documentation requirements. So this is all about creating and maintaining policies and procedures internally that comply with the security rule provisions, maintaining that documentation internally for a period of 6 years, and then also updating that documentation periodically based on either organizational change, if there's new systems that are being put in, or at a minimum, I would say annually. And then finally, the compliance arm of the organizational safeguards. So the Department of Health and Human Services, specifically the Office for Civil Rights, the OCR, is responsible for administering and enforcing these standards. You will often hear that the HHS and OCR gets involved in the event of a breach. They are absolutely the organization that you would be working with to report that breach, and the OCR is the audit arm of that, where they would come into your organization and conduct their audit. But they are also now, over the last few years, have been doing things called desk audits, and they have developed an audit protocol where they are actually sampling healthcare covered entities and business associates and looking to ensure that they are compliant with HIPAA. So they're starting to become more proactive, and this is becoming more and more widespread and prevalent, where they're looking for HIPAA alignment and HIPAA compliance, even in the absence of a breach, trying to be more proactive in that auditing. Speaking of the auditing and those compliance issues, let's talk about the cost of noncompliance. When you think about noncompliance, your first thought tends to be on the violation side or a breach. There are 4 different categories of violations which measure essentially the level of neglect, the ability to avoid that breach, actions that were taken to correct it, the number of affected individuals or affected states even. Each of those categories carries a financial penalty, anywhere from $100 to $50,000 depending on the category. And within each category, you can have a maximum of up to $1.5 million per category per year. And it's important to understand that last part, per category per year. Often the large breaches that you'll read about in the paper are a full $1.5 million in multiple categories. And that's just on the violations piece from HIPAA. You can also have state and federal fines, not just the state that you operate your business in, but if the breached data contains member records from other states, those states can impose fines and penalties as well. And finally, if there is true malicious intent and strong neglect, criminal penalties can also be applied up to a maximum of 10 years in jail. We just talked about the OCR's desk audit protocols and process there, and that's what's on the right-hand side of the slide. So on the left, we've had a breach, clearly we're in fault, and now it's time to assess a penalty. The OCR is trying to be more proactive in ensuring that organizations take HIPAA seriously and are really making steps towards achieving HIPAA compliance. And so they are now doing these desktop audits and looking for different failure points. And there are any number of reasons that you could be imposed a penalty, but some of the most recent ones and things that I would consider to be low-hanging fruit, failure to maintain documented policies and procedures, failure to conduct employee training on a regular basis, and also documenting that it was completed, and then failure to complete and maintain your BAA with your third-party service providers. Really 2 parts there. One is to complete and maintain those BAAs, but also for those of you on the phone who are saying to yourself, okay, good, I've got my BAA in place. With the omnibus rule that came out in 2013, there are some new requirements that your BAA needs to meet. And so if you have not gone through the process of realigning and revising your BAAs in 2014 or beyond, that was actually one of the critical findings that came out of the desktop audit process. So again, just kind of another lesson learned there that I want to pass on, that just because you have a BAA, if you have not updated it to align to omnibus, that's something that needs to be addressed. Okay, so we've spent the first 20 minutes or so talking about what is HIPAA, why is it important, what are the different components of the security rule. I now want to spend the remainder of the call talking about what can you guys do to help strengthen your security posture, and what are those 5 key takeaways that as you leave this call that you can go do within your organization to not only strengthen your security posture, but better align yourself towards achieving HIPAA compliance. The 5 different areas are implementing policies and procedures. As we just saw, the OCR desktop audits are looking to ensure that you have those fundamental pieces in place. Data discovery and asset inventory, training and awareness for your end users, implementing technical controls, and then finally conducting a security risk assessment. With policies and procedures, again, they're really that foundation for your IT and information security operations and really overall success with HIPAA compliance. As I've said, the HIPAA audit protocol is a useful tool to show you exactly what it is that the OCR is looking for when they do these desktop audits. And so you can do that to essentially reverse engineer and say, these are now my gaps in my current policy library. As you go about creating policies, it's not just that they exist, but that they are formally and consistently documented. Things like policy titles, owners, the effective dates, last review dates, change logs, revision history, and any other links to relevant procedures. What this shows, these things should all be included, and what it shows is that you have a mature policy program. Think of it as a policy on policies. All of our policies need to be consistently documented and formalized. We have a yearly review process to go through and make sure they are reflecting the organization's current risk analysis, any environmental changes, any regulatory requirements, and it really just shows the OCR the maturity of your program and that you are taking that foundational level of policies and procedures seriously. It's not just a Word doc that was created, 10 minutes before they arrive. Data discovery and asset inventory. This is one that I would say is not often included from a HIPAA lens, but it is so critical. And when you think about it, you can't protect what you can't find. As organizations grow, it is often whether it's through merger and acquisition or organically, it is often very much a patchwork of data storage, of assets from an IT infrastructure perspective. And so first, understanding what types of data your organization collects, stores, and transmits is so critical. It will help you to identify those key systems, different data repositories, what are your business and organizational units that are involved in a data's life cycle, understanding where you have risk from a data entering and leaving the organization. Until you understand how the data flows, you can't truly understand where the data lives. And then, once you know what assets store that data, you can now appropriately control and secure them. In that same vein, creating an asset inventory to not only track the sensitive data, but track it to the level of where the information resides. The asset inventory, just like policies and procedures, should be formalized and include things like end-user workstations, asset owners, configuration information, both the physical and logical location mappings. The stronger you can make your asset inventory, the more it becomes a tool, not just for IT maintenance and operations, but also from a HIPAA perspective, can be used as a piece of evidence in the event of a breach. One of our most recent clients had a scenario of a lost laptop, and the OCR was brought in, and we were there to help assist our client. And because the client's asset inventory was strong enough to show exactly who that laptop was assigned to, what system-level access that person had access to, and through the asset inventory that machine had full disk pre-boot authentication encryption in place, we were able to avoid having to declare a breach. And again, that was because we had the asset inventory to a mature state where we could make that tie back from a very systematic and technical control perspective. The OCR was able to gain confidence there that the machine, although lost, was fully encrypted, and we knew who the owner and what level of system access they had. So again, often data discovery and asset inventory can be a very IT-centric task, but it can be used very well in a HIPAA risk assessment and dealing with the OCR and potential breach scenario. Number 3, training and awareness, and I want to spend a minute here because really when you think about today's threat landscape, this is one that is so critical, not just from a HIPAA perspective, but if I can put on my just general security practitioner hat for a second, your workforce represents, your end users and your workforce represent by far your largest attack surface. If I am an external attacker trying to gain access to your environment, and I think about my return on investment or my level of time and effort, rather than trying to find you digitally in the internet, rather than trying to breach your firewall, subvert your intrusion prevention and detection systems, rather than trying to gain elevated access on the network, I'm instead just going to take 10 minutes, send your employees an email, and let one of your employees authenticate to my fake website, and now I have valid credentials, username and password, and I can access your environment through a completely authorized and validated session through one of your active employees. So it is you've heard about things like WannaCry and the ransomware that is really becoming a top attack, an attack vector, I should say, in today's environment. It is great that HIPAA requires training and awareness, and so use this opportunity to not only strengthen your alignment with HIPAA, but also strengthen your organization's overall security posture. Your IT and information security directors will thank you. From a HIPAA perspective specifically, your workforce should know and understand HIPAA as part of the training. Also know and understand your specific compliance policies and procedures, and then complete that training at least annually, also ideally at the time of hire, and then you as an organization need to be able to document and maintain that documentation of when training was completed. Consider training your users about additional security topics in addition to just HIPAA, things like phishing, safe web browsing, password management, data security, any of the relevant topics today. Take the opportunity to not just train on HIPAA, but other security topics to strengthen the overall security posture. So number 4, implement technical controls. It's important to think of this not as a silver bullet, but really just an arrow in your quiver. There are so many different technologies that can be leveraged, and it's really ideally looking to first, through the risk analysis process, identify areas where you need mitigating controls and where technology can help supplement that. Things like encryption, intrusion detection, audit logging, event monitoring, these are all common areas where tools and technologies can provide immense value. Automated technical controls, when they are configured proper, can absolutely be a strong mechanism to prevent and or even detect poor end user behaviors. So again, there's no one single tool that I can tell you to go install and you will be HIPAA compliant. There is no one tool that will protect you from every type of attack. It is absolutely a mindset of security and layers of defense. But think of technical controls and technical tools as a way to supplement the foundation that's been put in place through those policies and procedures, through that training. These are additional arrows to go in your quiver to help strengthen your position. Finally, number 5, demonstrate that you understand your environment and take HIPAA security seriously. This is the security risk assessment process. In our experience, in the event of a breach, and again, knock on wood that you never have to go through it, it is the number 1 most requested item by the OCR. As an organization is breached and the OCR is involved, they first want to understand when was the last time you conducted a risk assessment. Prove to us that you have been taking security seriously, you understood your organizational risks and mitigation plans, and then when was the last time you did a security risk assessment post-breach? Have you now reevaluated that analysis, identified issues, and already begun remediation activities? When you can show that level of maturity and understanding of risk, it goes a long way to helping lessen your penalties through the OCR because they understand that you are aware of the issues, you are proactively addressing those issues, and it doesn't mean that the OCR needs to now come in and try and identify all those. As we said earlier, there is no single approved risk assessment methodology that you should all go follow. HIPAA and the OCR leaves it up to you with those foundational elements of evaluate, implement, document, and maintain to document and conduct your risk assessment as you see fit, whether that's internally or with a third party. However, that risk analysis should always include a clear description of the scope, the audit methodology and framework that was used, what were the identified risks, and most importantly, what are the remediation action items that were planned, are in progress, and have been completed. Again, being able to show that holistic risk assessment process is so critical to allowing the OCR to understand that you have a good handle on your organization. Even in the absence of a breach, it's a great step to take for all of you on the phone to understand what does my current environment, my landscape look like today? How do I put a digital fence around that? How do I control the risks from my own inside individuals and employees? How do I control the risks from an external perspective? It allows you to kind of put your arms around this thing called HIPAA compliance and information security and truly start to understand what that threat landscape looks like and how we can put a plan together to address it. So let's take a quick review of these 5 areas again. First and foremost, the foundational policies and procedures. Next, take a look at your data. Try and discover how that's coming into the organization, what different types of data, how it's being used, how it leaves the organization, and in a very similar vein, the asset inventory. Understand what are all of the both digital and physical assets that are within the environment, and where are the sensitive data stores that you now need to protect. Again, training awareness, can't stress this one enough. In today's threat landscape, it is so important for your end users to be educated on how to avoid security phishing attempts, on how to be strong security practitioners for your organization and strengthen that very large attack surface. If you think about the number of employees and the number of emails on a daily basis, that is essentially the same as someone trying to probe your firewall, right? Every time that is a potential attack that is coming through the network you need to deal with. Implementing technical controls, again, we talk about that this is not a silver bullet. This is just another arrow in your quiver to understand what are the different pieces of technologies and technical automated controls I can put in place to help supplement my entire program. And then finally, that security risk assessment, both as an annual requirement of HIPAA compliance as well as a proactive measure for your organization to truly understand the risks that are posed internally and externally to your employees, to your sensitive data, and to your critical assets. Finally, as a plug for us, how can KSM and KSMC help you? We are so proud to offer both a wide range of cybersecurity services, different financial and operational services, as well as some financial advisory services that are all tailored for the healthcare industry. Our top bar here, you can see the cybersecurity team covers a wide range of services through governance, risk, and compliance, conducting those risk assessments for you, all the way through to those technical controls that we talked about with identity and access management, information and privacy protection, the insider threat and crisis management. Again, knock on wood, hopefully you don't need those services, but in the event of a breach, we are there to help. Security architecture and strategy, and then finally the threat intelligence and vulnerability management. On more of the operations and financial side, we deal a lot with hospitals and health systems as well as physicians and practices, helping them with strategic problems, alignment, whether that's tax and financial planning, acquisition guidance, or even different valuation services and things like value-based care. Well, guys, thank you so much for the time today. I hope that this was helpful. Again, it's very quick to try and put all of HIPAA 101 into a 30-minute presentation, but I hope you're walking away with a slightly better understanding of what is HIPAA, what do I need to be thinking about, and again, what are those 5 key takeaways that I can go and strengthen not only my alignment with HIPAA, but my overall security posture. Again, thank you for the time, and we appreciate you guys joining. Have a great one.